My name is Michael Kolios, and I'm in the Department of Physics here at Ryerson University, and I'm a Canada Research Chair in Biomedical Applications of Ultrasound. So the prime motivation of this work is to use ultrasound as a technology to monitor cancer treatments. When cells are normal, they have a particular structure. But when cells die, if you actually look at how they change their structure quite a bit. When cells are intact, they scatter sound in a very different way than when they're breaking up, dying. And not only does that produce an increase in echogenicity, so in other words, the image becomes much brighter when cells die, but it also changes the frequency of the sound that scatters off these dying cells. Ultrasound behaves a little bit like radar. You send an ultrasound wave, a pulse, it travels, it hits something, it comes back. In photoacoustic imaging, it's a bit more like lightning and thunder. We send a pulse of light inside the tissue, and wherever it gets absorbed, it creates a pressure wave that then we can detect with our ultrasound transducers. And because primarily blood absorbs the light that we shine tissues with, photoacoustic imaging is very good to quantify blood, to look at blood oxygenation and other qualities of blood that are important for the detection and identification of tumors. The ultrasound, when it uses very low intensities, you could use it to image tissues. But when you increase the volume, so to speak, or you increase the intensity, right, you could actually burn tissues. So you could look at, let's say, a liver cancer and focus the ultrasound exactly where the cancer is and heat it and kill it. Patients undergo chemotherapy or radiation therapy for weeks, if not months, and at no point during that treatment do they really sit down and assess whether the treatment is working the way you think it is. What we're trying to do with our technology is we're trying to use ultrasound to see if the treatment is actually killing cancer cells immediately. So it has advantages over surgery. It's not invasive. In surgery, you'd have to, open up a patient and try to remove the tumor. With high-intensity focused ultrasound, you don't have to open up the patient. And in radiation, one limiting factor is normal tissue cytotoxicity. In other words, when you irradiate the patient, you don't just irradiate the tumor, you irradiate also normal tissue. We hope that this technology can assist the physician or the oncologist in making a decision as to whether they should switch the treatment to some new kind of drug or some new kind of therapy that hopefully would benefit the patient. The type of research that we're doing involves not only using the high-intensity focused ultrasound, but developing agents such as microbubbles or nanoemulsions that enhance that effect. And that's where the novelty of the work comes from. We have collaborations with Sunnybrook Hospital, with St. Michael's Hospital, where a lot of my students work there and work on computer programs or the technology used to look at, let's say, cell death during cancer treatments. Well, Ryerson University has helped me enormously in this research. It provides an excellent academic environment where I can attract top quality students and postdoctoral fellows, graduate students, undergraduate students, and has helped me to take these technologies from the lab bench to the bedside.